This week on Let's Talk About Mental Health, I'm talking about the different types of support available for improving your mental health and what to expect. So let's get talking. This is Let's Talk About Mental Health, a weekly podcast about mental health and well-being hosted by Jeremy Godwin. Let's talk about mental health, because the more we talk about it, the easier it gets. Hello and welcome to episode 33 of Let's Talk About Mental Health, the weekly podcast about improving your mental health and well-being. I'm Jeremy Godwin, thank you for joining me. This week I'm talking about support. I talk a lot about the importance of getting support for your mental health in Let's Talk About Mental Health, and so this week I'll be discussing the different types of support that are available, what to expect, and how they can help you to improve and maintain your mental health and well-being. So let's talk. Admitting that you might need some support to help improve your mental health can be confronting and even scary, especially if you don't know what to expect. And a lot of people put off getting the help that they need. According to some research by the Black Dog Institute, in Australia alone, it's estimated that 54% of people with mental illness do not access any treatment, and that the number of people who do access treatment is half that of people with physical disorders. Now, considering that each year between 20 and 25% of us will experience a mental health condition, and that roughly 45% of us will experience one at some point in our lifetime, that is a lot of people not getting help to deal with serious mental health issues. There are almost 300 disorders listed in the DSM-5, which is the standard diagnostic tool that gets used in mental health. Most conditions can be broken up into 7 major categories, which are mood disorders like depression or bipolar disorder, anxiety disorders, personality disorders, psychotic disorders like schizophrenia, eating disorders, trauma-related disorders like post-traumatic stress disorder, or substance abuse disorders, and I'll put the link for that in the transcript. Now, I bring this up just to flag as we get started with today's topic that depression and anxiety are the 2 most common conditions, and it's not unusual for someone with depression to also have anxiety and vice versa. Nearly half of all people who are diagnosed with depression are also diagnosed with anxiety. Now, with all of those different conditions that are out there, I'm not going to be able to give you a rundown of the support options for every single one of those nearly 300. But what I'll be talking about today is quite broad, and because depression and anxiety are the 2 most common conditions, you'll find that I'm probably leaning on that a fair bit as well. So just be aware. Now, how do you know when you might need support? So in a minute, we'll talk about what support looks and feels like, but how do you know when you might need support? Well, look, it's different for everyone, but some of the common warning signs are long-lasting sadness or irritability, extremely high and low moods, excessive fear, worry, or anxiety, social withdrawal, and dramatic changes in eating or sleeping habits. So generally, if you're experiencing symptoms like these for 2 or more weeks, it's highly recommended that you seek professional support. So, what does support look and feel like? Well, before we dive in, let me just make 4 really quick points that you need to keep in mind as I talk through this topic today. Number 1, every single one of us is unique, and so that means that you need to consider what support options might be best for you based on your own circumstances, preferences, and even the current severity of your condition. Also, bear in mind that what works today won't necessarily continue to work for you tomorrow, because things do change. So it's important to monitor your mental health daily and to keep on top of it, just like you hopefully would do with your physical health. The second thing to bear in mind is that being diagnosed with a mental health condition is not the end of the world. In fact, it is the start of a better future. Because once you know for sure what you're dealing with, then you can start to put in place ways to improve your situation over time. The third point is that physical, mental, and spiritual health are all connected, as well as social health. And so if you're struggling with one area of your health, it's important to look at all areas and put in place solutions to manage your overall health. And then the fourth and final point that I want you to keep in mind with today's topic is that everything takes time and effort. And so none of the options that I'm going to talk about today will instantly make you feel better. However, with time and perseverance, they will definitely improve your condition and your quality of life. And so with those points in mind, let's get into the good stuff, support options. I'm going to start with external options, and then we'll spend a few minutes towards the end of the episode on your internal options, which are the things that you can do to support yourself at the same time as you're getting help externally. Improving your mental health takes work, and that involves working on your condition yourself, as well as getting professional support, because you can't do everything alone. But also, external support won't be successful unless you play your part, and I'll explain more about that shortly. The first type of external support I'm going to discuss is seeing your doctor or general practitioner. Going to the doctor is often the first step for most of us because it's the most accessible way to have our health issues diagnosed. If you've been struggling with your mental health for a prolonged period, 2 weeks or more, then you really do need to go and see a doctor to talk about what's been happening, and the sooner, the better. It's important to get a proper diagnosis. Please don't let Dr. Google do your diagnosis. Getting a proper diagnosis from a doctor can help to put things into context, but it's also about making sure that you're treating the right thing. For example, if you had a broken leg, you wouldn't expect that taking paracetamol would fix it. Now, if you don't feel comfortable talking to your regular doctor, then that is a problem. And it's probably the most common issue for many of us, in that we need to find a doctor who we have a good rapport with and to whom we can disclose anything. Now, that might mean that you need to shop around and try a couple of different doctors until you find the one that feels right for you. And then once you do, make sure that you have your medical records transferred from your old doctor once you find the one who you feel comfortable with. When you talk to your doctor about what's going on, you'll usually expect them to spend a fair amount of time exploring what symptoms you've been experiencing, what internal and external factors have been affecting you, and also looking at physical symptoms to ensure that they're making a sound diagnosis. This might actually take a few visits. You might also be asked to complete some questionnaires, such as the K10, which is the Kessler Psychological Distress Scale, and those types of tools are used in order to better understand your current state. The biggest challenge when talking to a doctor about what's going on is that you need to be completely open and honest. But it's the single most important thing that you can do because that will allow them to get a much clearer picture of your situation. If that means that you ugly cry, don't worry, they've seen much worse. Your doctor may choose to prescribe you medication, or they might refer you to see someone for therapy, or both. So let's explore those two types of support next. And we'll start with medication. Now, with so many different conditions, like I mentioned before, there are a huge number of medications that might be considered. So I'm not going to be able to go into specifics of different treatments here. What I will say, though, is that there are a few main things to be aware of when it comes to medication. First of all, there are different types of medications for each condition, and not all types will be effective. For example, I had to trial 3 different types of antidepressants before we found one that worked for me based on my biology, so it can be a bit of trial and error, and that of course takes time. Even once your doctor finds the medication that's right for you, all medications take time to work. So if you're expecting that you and your doctor can just quickly find the right treatment for you and that it will cure you overnight, I'm sorry to say, but that just will not happen in most cases. Between trying different meds and then stabilizing my treatment once we found the right one, it took more than 6 months to begin to see positive effects. So be patient and work with your doctor. And that means seeing them regularly, especially in the early stages of treatment. Medications do a lot of good. However, all medications can have side effects, and that will depend on a number of factors, including your biology. For me, with antidepressants, I developed a skin condition, I completely lost my libido, I found it almost impossible to get a full night's sleep, and I was constantly overheated and dripping with sweat. It was not fun. But it's up to you to decide if the side effects outweigh the benefits of the treatment, and in my case, I decided that the side effects were worth it. Now, the other consideration with medication is if you do decide to ever discontinue treatment, never just stop taking your meds. I mean it, never. The effects can be absolutely horrendous and even life-threatening. Your brain chemistry is really delicate, so any changes need to be carefully managed with your doctor. For me, when I decided that I was ready after a few years to come off my meds, and that was a few years back now, it took nearly 2 years in total. First, we had to wean me off my anti-anxiety meds, and then we had to wean me off the antidepressants, which were at the time at the highest possible dosage. It was a really difficult process, and the withdrawal symptoms were awful, but I did it safely with the support of my doctor, and that is the right thing to do. So never just discontinue your meds. Okay, so that's what to expect for medication. Now let's talk about the other main type of treatment, therapy. Your doctor might refer you to a counsellor, a psychologist or psychiatrist, or you might find one yourself. You can do an online search or do a ring around to find someone in your area, or you can use apps to connect you with professionals in your area. Finding a professional that you like and you feel comfortable with is really hard. And this week I've partnered with an app called Avalo for an unpaid cross-promotion. This is the first time I've ever done any kind of promotion on Let's Talk About Mental Health, and I'm only doing this because I genuinely believe in the app. The app is a really great way of finding a professional to talk to, and it's free, which is my favorite price for anything. So normally when you try to find a mental health professional, you pick someone based on where they're located and hope for the best, which is very hit and miss. And I don't know about you, but I've had some really shitty experiences with seeing therapists or counselors who I just did not feel comfortable with or click with at all. Using an app like Avalo, you can talk to mental health professionals as well as other people dealing with mental health challenges. So the advantage is that it provides a much less confronting way of finding someone than having to go and audition professionals by phone or go face-to-face. And what I love is it's completely anonymous and confidential. You can find professionals in your area, although it's mainly North America at this stage, but it's growing. And Avalo has a very strong focus on being troll-free and stigma-free. If you're interested, Avalo is available for iOS and Android, or you can find out more at www.avalo.app. Now, please note, Avalo is not a therapy platform, so it's not like you sit there and get your therapy through the app. It helps you to find professionals. So if you do find someone that you'd like to work with, you then need to book with them directly to actually start the therapeutic relationship. However, the reason why I'm recommending it today is that you can use it to chat to them beforehand through the app. So it's like the audition process happening through your app. And that can help you to decide if they feel like a good fit for you in a far less confrontational way than having to actually go physically meet with people or pick up the phone. So, once you have found a professional that you want to talk to, what can you expect from therapy? Well, look, it depends on the type of professional that you choose. You might work with a counsellor who uses a person-centric approach to help you explore your emotions and identify solutions. You might work with a psychologist who would use a variety of approaches to reduce distress and problems with their patients, as well as conducting research. You might work with a psychiatrist who will have a medical degree and tend to treat disorders, and then may also be likely to prescribe medication. Or you might work with a social worker who might run community programs or group sessions like support groups. The main thing to be aware of is that you should always check to confirm the qualifications of the person that you want to work with. Each country has their own rules and regulations, and often professionals will be required to register with an industry body. For example, here in Australia, we have the ACA, or the Australian Counselling Association, and bodies like that are responsible for accreditation and ensuring that their members behave professionally and ethically at all times. I do not recommend that you work with someone who doesn't have the appropriate training and qualifications. Dealing with mental health issues is really delicate stuff, and the last thing that you want is to wind up in a worse situation because the person who's supposed to be helping you actually has no idea what they're doing. So make sure you do your research beforehand. Now, regardless of what type of professional that you see, one of the common things that the different forms of therapeutic treatment have in common is that you will probably find yourself doing a lot of talking about your past and your present in order to identify solutions for your challenges. Now, that can be exhausting and confronting, and it puts you in a really vulnerable and often uncomfortable position, but it is worth it. Unless you work through what has happened and why, and you have a professional guide you towards potential solutions, you will quite likely remain stuck in the situation that you're in. And as I said in last week's episode about letting go, being stuck will make you miserable. Therapeutic treatments like counselling or working with a psychologist are often combined with medication as the main forms of treatment for many health conditions like depression and anxiety. So with all of the main types of treatment, there are a few things that you should consider. Depending on your country, you'll need to do a little research to find out what the guidelines are if you're using public or private services that are aligned to state-based or country-based healthcare services or insurance. For example, here in Australia, there are some different ways that you can see a registered psychologist for a very small number of sessions and have it either paid for or partially paid for by the government. But the rules and guidelines are quite strict, and it doesn't cover a lot of services, including, for example, seeing a counsellor or whatnot. In the UK, of course, you have different rules under the NHS. In the US, there will quite often be rules that are specific to your insurance provider. In other countries, it's different again. So usually a good starting point is either a little bit of research on the internet to find out what's appropriate in your state or country, or talk to your doctor. Unfortunately, one thing that most countries do have in common is that mental health care is often grossly underfunded, and you will often find that the ownership for finding support and paying for it falls back on you. So my advice is to look at the options that fit for you based on the severity of your specific situation. For example, you might find it more cost-effective to see a counsellor for a larger number of sessions rather than a psychologist or psychiatrist for a small number of sessions if the cost works out to be the same, depending on their rates. You need to make the decision that's right for you based on the severity of your condition. Whatever you choose to do, deal with issues while they're still small if you can, because things can deteriorate rapidly if you let them go. Early intervention is absolutely essential. I know it's often really hard to take that first step. It took several months for me to finally be honest about it with my doctor, even though I was going and seeing him regularly due to all of the physical symptoms that I was having as a side effect of my own situation. My doctor was asking me a lot about my mental health, and I just kept on pretending that everything was fine until I just could not pretend any longer. And when I did finally tell him what was going on, he was so kind, and it was such a relief to admit it, and I burst into tears. So don't put it off. Have those conversations. I know they're hard to do, but rip that band-aid off and just talk to your doctor. Talk to a professional. Now, depending on your situation or your preferences, there are lots of other support options that are out there which relate in some shape or form to the ones that I've discussed so far, such as treatment centres, for example, rehab for alcohol addiction. There's mental health facilities, which tend to deal with more severe cases and might be either inpatient or outpatient programs, or they might be a combination of both. And then there's also community support programs like support groups for alcoholics, narcotics, gambling, and so on. Please note that some support services, especially some of the free ones, are often aligned to religious organisations, and so their methodology and agenda might be underscored by very specific spiritual and religious beliefs. It's worthwhile taking the time to understand who you're dealing with first, even by just reading the About Us section of their website, to understand their approach so that you can then make an informed decision and select a service that is aligned with your own values and beliefs. For example, a lot of Alcoholics Anonymous and Narcotics Anonymous tend to be religious in nature, and a key focus of their program is on surrendering to a higher power. If you aren't religious, you may find that really difficult to deal with. It may not even be remotely appropriate for you. So choose a support program or a support mechanism that aligns with your own values and beliefs. There are also phone support lines that you can call or online services that you can use. For example, in Australia, there's Mental Health Online, which provides free online treatment services, and I'll include the link in the transcript. Many of these are crisis-focused. However, there are also services for situations like financial counselling or grief counselling. And so you may find it helpful to have a chat with someone if these are issues that you're struggling with, rather than going through the process of finding a therapist or counsellor to work with face-to-face, which can take longer. As I said before, it's about finding what works for you. Now, you can also get support from friends and family. However, I really do challenge you not to rely solely on this form of support. Why? Well, because people who care about you will find it very hard to be objective. And also, they're probably not qualified to provide support. And if they are qualified, then they'll know that it's a conflict of interest for them to treat you because they won't realistically be able to remain impartial. And then, of course, remember that if you are in an emergency situation where your life or someone else's life is in danger, call emergency services. So in terms of all of those types of resources, as well as emergency services, you can find a list of resources for most English-speaking countries at letstalkaboutmentalhealth.com.au/resources. Now, I mentioned earlier in the episode that support is about both external and internal support. So what does internal support look and feel like? Well, there are lots of things that you can choose to do to complement the external support that you're receiving, such as daily activities like gratitude practice, mindfulness, meditation, journaling, even tuning into your favorite weekly mental health podcast. Look, I talk about these types of proactive activities a lot in this show, and there's mounting evidence that these types of practices can improve your mental health over the long term. You can also use websites and apps that work for you. So apps like Headspace and Calm provide you with tools and resources to try different things and see what works for you. There are also natural therapies that may have a positive effect on some conditions: St. John's wort, vitamin D, valerian. I'll put a link in the transcript to some evidence around some research that's been done on natural therapies. However, let me just say that if you are taking any other medication, then it is very important to talk to your doctor and make sure that you're not going to have any issues or side effects. But you can certainly look into natural therapies to complement your other treatment options. Another thing that you can do to support yourself is to have a healthy lifestyle. I talk a lot about the fact that prevention is better than cure, and that's why a healthy lifestyle and healthy coping mechanisms is so important. But it also helps to address symptoms on an immediate basis. If you're feeling like crap, go get outdoors. Get some sunshine. Vitamin D is really good for you. Get some fresh air and get out into nature, especially if you live in an urban environment. Sometimes that can be just the tonic that you need. When you're talking about your health as well, look after your overall health. I mentioned before that your health isn't just about the state of your body. Your health is made up of your physical health, mental health, spiritual health, and social health. So look at ways to improve all areas of your life. When I talk about spiritual health, it's not the same as religion. You can be spiritual but not religious. It's about whatever feels right for you. In short, it's about developing your sense of belonging, of being part of something bigger than just yourself. And this is something I talk about a lot in Let's Talk About Mental Health. Beyond spiritual health as well is social health, which is about your connection with family, friends, acquaintances, and your community. You're not an island, and we human beings need to feel connected with others in order to be satisfied. Now, connection can involve lots of things. It can be catching up with friends or family. It can be joining community groups and community centres, volunteering, getting involved in local interest groups like a book club or sports club. Find out what works for you. Now, this is something that I discussed back in episode 15, loneliness, so you might find that episode helpful to revisit, and you can find it at letstalkaboutmentalhealth.com.au/episodes. Some other things that you can do for yourself: learn. Do research about topics that fascinate you. Read books. Learn a new language. Challenge yourself to learn new skills. Why? Because learning keeps your mind elastic, and it helps you to build your knowledge and skills, which makes you feel more engaged in the broader world. Have fun. Do things regularly that make you smile. And if you can, grab a friend or relative to join you and double the fun. Life should never be 100% serious because that's boring and exhausting. And beyond that, try new things. Get a new hairdo, start a new fashion trend, play a sport, write, paint, invent stuff. Just do things that challenge you and that tap into your passions and your creativity. You might also want to travel. Well, maybe wait to travel until the world's not dealing with the pandemic. But in the meantime, you can explore places that you want to visit in the future online. If you're interested in museums and galleries, some of the world's biggest institutions, like the British Museum, have adapted to COVID-19 and are offering immersive tours through their collections online, so you can travel from the comfort of your couch. Find things that get you excited. And further to that, practice self-care. I talked about self-care in a lot of detail back in episode 6, so check that out and find options that work for you. But whatever you choose to do things for your self-care often. The main message I want you to take away from today's episode is that there are so many different options available to support you in improving your mental health. So don't go it alone or just ignore it. But also, don't abdicate all responsibility to someone else and expect them to fix you. It's your health, and you have the biggest role to play in improving your mental health and well-being. Because when it comes to support, what it all boils down to is this. There is no one-size-fits-all approach to mental health support. And what you choose to do will depend on a range of factors, including your personality and your preferences. No single option will be the magic pill that cures your condition overnight. But when you combine multiple forms of support, both external and internal support activities, then you'll start to see improvements over time. Like everything with mental health, it takes constant effort and perseverance. But the truth of the matter is that there are many kind people out there who will help you on your path to recovery, and who will support you as you try different things to find out what works for you. You are not alone. And once you find the support systems that work for you, then you will start to see improvements over the long term. Because it can get better, and it will get better. That's nearly it for this week. Now, each week I like to finish up by sharing a quote about the week's topic, and encourage you to take a few moments to reflect on it and consider what it means to you. This week's quote is by Misty Copeland, and it is, "Anything is possible when you have the right people there to support you." Let me repeat that. Anything is possible when you have the right people there to support you. Alright, that's it for this week's episode. Next week I'll be talking about addiction. I'll be discussing the impact of addiction on you and those you care about, and how you can identify if it's time to do something about it. I hope you'll join me for that episode, which will be released on Monday morning in Australia and New Zealand, Sunday evening in the UK and Ireland, and Sunday afternoon in the US and Canada. You can find past episodes and additional content at the website, which is letstalkaboutmentalhealth.com.au. That's letstalkaboutmentalhealth.com.au. You can also find Let's Talk About Mental Health on Instagram, Facebook, and Pinterest at LTA Mental Health. That's at LTA Mental Health. If you enjoyed this episode, please take a moment to leave a 5-star review on your podcast platform of choice, and tell someone that you know about the show, because word of mouth really helps new people to discover the program. Thank you very much for joining me today. Look after yourself and make a conscious effort to share positivity and kindness out into the world, because you get back what you put out. Take care and talk to you next time.